So let's talk about nails now. So nails are going to consist of stratified squamous epithelium, just like everything else in the epidermis. It's going to be growing directly from the luminal region that is going to be directly superficial to the nail root itself. The growth of the nail is going to be growing very similar to what we see with hair. And as we grow from the nail root in the luminal region, we start getting that keratinization. Now, what we don't see is we don't see this kind of warping of the proteins. And so we have this translucent keratinized plate that gets formed within the nail. As the nail exits from the nail bed itself, we lose the structural integrity that allowed for the plate to form. And so we will start seeing opacing at the free edge of the nail. And that opacing that we see at the free edge of the nail is because we lose the ability to align the proteins and the cells in a flat plate. So the divisions that we'll see within the nail include the free edge, that is the edge of the nail that is at the end of the finger or toe, the body of the nail, which is the visible portion of the nail, the root, which is going to be the most deep part of the nail itself, the lalunae, which is the white crescent that we see at the base of the nail, the eponychium, which is the fold of the epidermis that holds the nail in place and provides for a bit of tensional restriction to the nail itself. And then we have the nail bed. The nail bed is the underlying stratum of epidermis from which the nail will be growing over as it moves distally. And so if we look at the nail itself in terms of its anatomical schematic, the most proximal and most deep part of the nail is the nail root and nail groove. This is where the matrix of the nail itself will be present. It will be growing superficially and distally from this matrix. As it grows superficially and distally, it's going to interact with eponychium and continue to grow distally. The eponychium is going to dictate the angulation of the nail growth itself. The interaction of the eponychium with the nail matrix forms the lalunae. As the nail grows from the lalunae distally, it starts interacting with more of a flattened surface of epidermis, and that forms the nail bed. The entirety of the nail itself that we see is the nail plate. And then at the edge of the digit, we get the free edge of the nail itself. The eponychium is going to be a curved structure of epidermal tissue. And this epidermal tissue, as long as it stays intact, will keep the nail growing in the correct pattern. When we start having hydration issues around the lalunae, where the eponychium and the nail matrix are meeting up, we will start seeing haphazard nail plate growth. That is what some people refer to as the development of quote unquote hang nails. So let's talk a little about the function of nails, and we'll look at how does the nail actually grow in terms of its patterning, very similar to what we saw with hair. The function of the nail is to protect the tip of the digit. What it does is it adds a cushionary zone to it, where we will have compression across the nail plate, which splays the pressure around the distal edge of the digit, so thereby protecting the distal phalange that happens to be there. It's going to increase grip tension by having a hard stop to the distal dermis, thereby allowing for you to have pincer grip action within the digits. Not so much for us, but for other mammals, we will see predator and prey defense mechanisms coming from these nails. For us, as well as for other mammals, we will see it in terms of grooming behavior. It's the nail that allows us to sweep our hands through our hair in order to reconfigure where we want our scalp hair to be. It's the nails that will be used for removal of microscopic organisms around the hair that's causing irritation. To a certain extent, nails can be used in terms of mating behavior as it relates to this grooming behavior. However, most of the nail behavioring that we see is predominantly cosmetic and not necessarily towards grooming or mating behaviors. As it relates to the phases of growth, the nails will continue to grow. Unlike with the hair, where we see this replenishing every month or so of the follicle, we don't see that with the nail itself. We have this continuous growth from the matrix. And it's continuous growth superficially and distally towards the hyponychium free edge of the nail. As we push outwards, we get that keratinization that takes place. The keratinization allows for the flattening of the nail plate until we get to the free edge in what's referred to as the hyponychium. That's where the keratinization of proteins no longer have the flat arrangement, and they will start to spiral, and they will start to spiral in the same spiraling that we see with the hair, which is why as nails continue to grow excessively long, they will start to spiral in and around themselves, very similar to the spiraling that we'll see with the hair. Now, you also notice with people who have excessively long fingernails is that you will start seeing a increased density of that keratinized cell, which leads to a very thick hyponychium at the free edge of the nail itself. The amount of theobondings that we have taking place within the hair, we will also see within the nail itself. And one of the things that you can start to see with people who have excessive amounts of theobonding, those people who have very curly and wavy hair, is you will actually see lines running along the nail plate itself. And those lines running along the nail plate itself is going to dictate the curvature that the nail will take as it exits the free edge and forms the hyponychium of the nail itself.